Did you know that stroke is one of the leading causes of death and disability worldwide? Preventing a stroke can make a significant difference not only in a person's lifespan, but also in their quality of life. Stroke prevention is categorized into two main types: primary and secondary. Primary prevention focuses on preventing the first stroke from happening, while secondary prevention aims to prevent recurrent strokes or complications after the first stroke has occurred. Now let's delve into the different prevention methods, starting with antiplatelet therapy. Antiplatelet therapy plays a crucial role in stroke prevention. For primary prevention, current evidence isn't quite there yet to firmly establish a protective role for antiplatelet agents for low-risk patients without a prior stroke or transient ischemic attack, known as TIA. When we talk about secondary prevention, ASA, or acetyl salicylic acid, is usually the initial antiplatelet of choice for stroke prevention. Other agents such as Agraноx R and clopidogrel are generally reserved for those who suffer cerebrovascular symptoms while on ASA, or for those unable to tolerate ASA. However, it's important to note that combining ASA and clopidogrel has shown no benefit and even increased the risk of major bleeding, as evidenced by the MASH and Charisma trials. Understanding these nuances is key to effective stroke prevention. Moving on, let's discuss the prevention methods related to carotid stenosis. Carotid stenosis is another significant factor in stroke prevention. This condition, which involves the narrowing of the carotid arteries, can increase the risk of stroke. Primary prevention for asymptomatic individuals is somewhat controversial. One method, carotid endarterectomy, is considered if stenosis exceeds 60%. This procedure can reduce the risk of stroke by 1% per year, but it also carries a 5% risk of complications. For secondary prevention, particularly for those who have previously suffered a stroke or transient ischemic attack in the carotid territory, carotid endarterectomy is more clearly beneficial. It provides the most benefit to those with symptomatic severe stenosis, ranging from 70 to 99%. The CREST trial also sheds light on this subject, suggesting that endarterectomy and carotid stenting offer similar benefits in reducing stroke, myocardial infarction, and death. However, stenting may lead to a higher rate of stroke, while endarterectomy may result in a higher rate of myocardial infarction during the peri-procedural period. Next, we will be discussing the prevention methods associated with atrial fibrillation. Atrial fibrillation is a common heart condition that can lead to stroke. This irregular heartbeat can cause blood to pool and form clots, increasing the risk of stroke. Primary and secondary prevention centers on the use of anticoagulants. Let's talk about risk stratification using the CHADS-2 score. This score helps determine the appropriate treatment. If the score is 0, indicating very low risk, an antiplatelet is recommended. For a score of 1, suggesting low risk, the choice between an anticoagulant or an antiplatelet is made based on patient-specific factors. For scores higher than 2, indicative of moderate to high risk, an anticoagulant is the go-to. Anticoagulation therapy includes options like warfarin, which is titrated to an INR of 2 to 3. Dabigatran, either 110 or 150 milligrams twice a day, may be an alternative to warfarin. However, use it with caution due to the lack of a reversal agent should bleeding occur. Now let's move on to the prevention methods related to hypertension. Hypertension, or high blood pressure, is a significant risk factor for stroke. For primary prevention, the target is blood pressure below 140/90, or even lower for those with diabetes or kidney disease. Ramipril, a medication, has proven effective for patients at high risk for cardiovascular disease. For secondary prevention, ACE inhibitors and thiazide diuretics are recommended for patients with a previous stroke or transient ischemic attack. Lastly, we will touch on lifestyle prevention methods. Lifestyle factors significantly affect the risk of stroke. Let's delve into some primary and secondary prevention methods. With hypercholesterolemia, statins can reduce the risk of stroke in patients with coronary artery disease or at high risk for cardiovascular events, even with normal cholesterol levels. For patients who've had a stroke, statins also reduce the risk of a subsequent occurrence. Now, on to diabetes. The ideal management involves maintaining an HbA1c level of less than 7% and fasting blood glucose between 4 and 7. Smoking is another significant risk factor. It increases the risk of stroke in a dose-dependent manner. However, the good news is that after cessation, the risk of stroke decreases to baseline within 2 to 5 years. Lastly, regular physical activity is a crucial lifestyle measure in stroke prevention. Its beneficial effect has a dose-related response in terms of intensity and duration of activity. Remember, prevention is always better than cure. Stay informed and take care of your health. Stroke rehabilitation is a crucial part of recovery, helping survivors regain their independence and improving their quality of life. The rehabilitation process is individualized, based on the severity and nature of impairment. It may require an inpatient program and continue through home care or outpatient services. A multidisciplinary approach is used, which includes dysphagia assessment and dietary modifications, communication rehabilitation, cognitive and psychological assessments, including screening for depression. Therapeutic exercise programs are designed to improve strength and coordination, while an assessment of ambulation evaluates the need for assistive devices, splints, or braces. Lastly, vocational rehabilitation may be needed to help survivors relearn skills needed for work. Remember, rehabilitation is a journey. It requires patience, persistence, and a positive mindset. So, stay patient, keep pushing forward, and always remember that every step, no matter how small, is a step towards recovery. Thank you for joining us on this important journey. That's it for our comprehensive guide on preventing ischemic stroke. It's our hope that this information empowers you to take proactive steps towards stroke prevention and recovery. If you found this video helpful, please give us a thumbs up. Your support means a lot to us, and it helps us to continue providing high-quality, informative content. We'd also love to hear from you. Please share your thoughts, experiences, or questions in the comments section below. Your feedback helps us make better content for you and the community. If you haven't already, please subscribe to Medicine Health 360. We have many more health-related videos lined up for you. Remember, your health is in your hands. Stay informed, stay healthy, and take care of yourself. Until next time, this is Medicine Health 360, signing off.